Okay, so this technique is an indirect extension technique. Indirect meaning that the treatment segment is on the bottom side. This individual has a right rotation instability, so consequently we have to move him onto the other side to bias him into left rotation to deal with his incapacity to handle right rotation. So we've dealt with that problem. He's in the right position. Place your patient on the right side. Locking guideline, if the patient will tolerate it, in this case I'm going to use a contralateral lock which will relatively extend some of those segments before we get to the treatment segment that we're going to deal with, because that one begins in a neutral position. If your patient is not comfortable, you may have to go towards an ipsilateral setup. But for our purposes today, we're just going to talk about a direction motion into a position that will relatively extend those bottom segments. So you want to have good control, patient in control of the torso, and that you have some degree of leverage to deal with the upper lever when you start building the barrier. We can use a physiological lock towards flexion, straighten out the bottom leg. If the patient is more comfortable towards a flexion position, then maintain it. If you felt you needed to get a more rigid lock, or the patient could tolerate, you could advance that leg towards extension to now create a vector that is in the direction of the barrier that we're going to be building, above and below. The next important step is to build the barrier. So we're going to build the barrier through the top lever. So if we're at that segment, let's get to 4. So there's, here's 4, here's 3, and if I moved the patient in an oblique direction, I would be creating an extension moment on top. That's opposite of what we really want to do on the bottom. So we're going to have to take the top joint here towards a superior anterior glide, which is again going to be a relative extension moment on the bottom. So let's just fine tune this. I'm going to build the barrier to get towards extension on the bottom. I'm going to use a lower treatment vector. Because I want to create an extension moment on the bottom, I'm going to use a flexion moment on the top. So I'm going to just choose oblique distraction with my bottom lever. So take up that barrier again, and then fall to here, and then now a 4. Small amplitude. Control it. Don't lose the stabilization. Keep it locked there, and then create an end range small amplitude motion.